Last year, it's estimated more than 14,000 new cases of cervical cancer were diagnosed in the United States. However, cervical cancer is very preventable if people take the certain precautions. And joining us now during Cervical Health Awareness Month is gynecologist Dr. Anjane Kobana from St. Luke's Health System. Good morning, Anjane.
Good morning.
First question, what is the main cause of cervical cancer?
The majority of cervical cancers are related to the HPV virus, which is a sexually transmitted disease. All women are at risk for potentially getting cervical cancer. So that's why it's so important for us to try to be aware of the things that we can do to prevent it.
And what steps should people take to reduce their risk of HPV and cervical cancer?
The number one thing they can do is actually get the HPV vaccine. It's available in the United States. It's typically offered for the age group of 9 all the way up to the age of 45. The targeted age group typically is around the ages of 11 to 13, and both boys and girls. There's also routine cervical cancer screening, formerly known as the Pap smear. For some women, they also may associate it with getting their Royal Woman exam, avoiding tobacco use, and also practicing safe sex precautions.
Can you tell me about the importance of preventative screenings?
So the average age of diagnosis in the United States is around 50. About 20% of cases actually present after the age of 65. But we also see cases obviously under the age of 50. The first Pap smear is typically done at the age of 21. And then there's a regular routine screening schedule that's offered for patients based on their age and risk factors.
I hear that the age has changed, how long, the years you go between Pap smears. Is it true that you don't have to go every single year? Has that changed at all?
So I want to make sure we make a distinction between two things. One is the Pap smear and the other is actually the pelvic exam.
Okay.
I think a lot of people tend to associate the Pap smear is just the pelvic exam, and those are actually two. It's just the Pap smear is just a small portion of the pelvic exam. I think women should still see their providers on a yearly basis, but their Pap smear schedule may be altered. So right now, women over the age of 30, their Pap test can be done every 3 years based on their risk factors. And what that Pap test may include could be the part where we look at the cells, or where we just look at the HPV portion of the Pap smear, because you can just get the Pap alone, or you can get the Pap plus HPV testing, or HPV testing alone, depending upon what your risk factors are. But with that being said, I think it's very important that we understand that you still should see your provider on a yearly basis, at which time your Pap smear may be done or it may not be done based on what your risk factors are. The most important thing I want to impart to patients right now is getting the HPV vaccine if you're in that age group where it applies. And it's important that we understand that it's also for males. We sometimes forget about teenage boys and we focus on the girls, but it's also really important that teenage boys also get the vaccine, because that actually helps lower the risk for our females in that age group.
Great. Thank you again so much, Dr. Kobana. We really appreciate your time.
Thank you.
To find a doctor or schedule a screening today, go to stlukeskc.org.